that, like lying on my back. I had been a full-time glasses wearer the past 12 years. I realised when I was looking, I cannot tell you how amazing it feels. Guys, sorry about the lighting, I know it's quite dark. Can you hear that noise outside? That's the rain. It's just literally done a torrential downpour outside. I'm checking in advance of my LASIK eye surgery, which is taking place tomorrow morning. I've been packing a bag to take with me tomorrow, and my outfit and stuff. So this is the bag that I'm bringing for tomorrow. It's a little gym bag that I got from Primark, and I've not used it yet, but it's the perfect size for the gym, or just obviously if you're packing up a few things. Put in it medications first and foremost. I need to take them first thing in the morning. I have brought a glasses case for my prescription glasses to go in. I'll pack these because they make the most sense, but I do think they put a pair in the bag. Also said to wear on the day comfortable clothing, so these are a couple of the items I've picked. I've taken out 3 pairs of joggers, so I've got a velour set, I've got a couple of cotton ones, all like just wide leg, neutral. Wear a nice comfy jumper. I've just got this sweatshirt from H&M. Also wear just my new trainers. Comfortable but stylish. Having a look in my aftercare, and I've taken up some notes, but there's just some like important things that I realised when I was looking. So after the surgery you get a combination of eye drops and eye ointment to heal the eyes. This is the one that I'm going for. It's the LASIK, and I have follow-up visits. I don't know if this is like on the day when I get it done, and my next visit is like up to 2 weeks. I think that's maybe more than likely, or they want to see you back the next day. I can't make sense of that. I need to. And then here's some interesting things. When I was looking, you can't wear eye makeup for 2 weeks, which is another kind of annoying thing. I know it's not a huge deal, but 2 weeks that I'm not able to wear it. And the sauna I'm not able to use for 4 weeks. And I was actually planning a spa day with my friend, so I can't do that now. And the shower, you can shower the next day, but you can't get water into the eyes. Feeling a bit surreal, to be honest, and I just have this sense of like, I just want to get this over with, because what if I can't go through this? What if I'm such a nervous Nelly on the morning that I'm like, I think the part I'm stressing about is, you know, this like clamping the eye, and also you have to lie on your back. I don't know how I feel about that, like lying on my back, having my eyes clamped. But yeah, it's all very exciting, but also I'll feel relieved once it's done. The name of the place I'm getting it done is Optimax in Glasgow, and they've got loads of different branches like around the UK. I'll sign out now and I'll hopefully check in with you again tomorrow. It's the morning of, and I slept better than I thought last night, and I don't know, I've been paranoid about my eyes feeling sore or dry. Anyways, I'm waiting on a lift in, and I'm getting these done in a matter of hours. I've got my comfy outfit on. I have my bag ready to go. I've got the leaflets for glasses. Once I'm done, I can just put these in. Oh, excuse me. Get some clips when I'm in there, and if not, I'll check in with you as soon as I can. Wish me luck. Even some regular preservative-free drops, eye drops even, and I think you can just use them like. Guys, it's been over a week later since I've had my LASIK eye surgery, and first things first, I cannot tell you how amazing it feels to just be even recording this right now a don't have lenses in, I don't need to wear glasses. I was wearing sunglasses earlier and they're not prescription glasses. Oh my God. I've been on cloud nine. It's been over a week later to answer questions that I think, things that I personally wanted to know before, and that maybe would have been helpful if I did know before. But the truth was, I didn't do a lot of research before getting this done. It was a very quick decision before I knew what I was booked in, and it was the night before and it was happening. I purposely chose not to know every single little detail about this in case I got into my head about it and I got a bit, you know, went into overdrive. Anyways, I've put down a few questions that I'm going to answer. Why did I decide to get the LASIK eye surgery? So I had been a full-time glasses wearer the past 12 years. That's a really long time. And my eyesight in that period of time progressively got worse. Prescription has always been minus, so that means I can see close up, no problem, but I really struggled with seeing from a distance, and that's how I first knew that I needed some kind of help, because everything was quite like blurry and I was really straining my eyes, and throughout the past few years I've had extremely bad eye strain related migraines, so it's always been on this side, always here, and it radiates up to the side of my head, result in really bad tension headaches. Parents kindly offered to gift me get my eyes done, and because they did, it kind of, the decision was made for me. I just thought, you know what, I would have put it off for a few more years. In terms of feeling anxious before the procedure, yes I was. Again, this is a reason why I didn't put too much research into what they actually do to the eye itself, because I knew that would freak me out, and obviously you need to be conscious for this. You can't get sedation, you need to be able to be calm and listen to instructions. So he came up with this vision in my head of me lying back, metal instruments being close to my eye and coming in and touching my eye, and that was the reason why I think I've put this off for so many years, because I thought, like, the idea of that, I couldn't put myself through it. Avoided looking at any videos specifically or pictures or anything of what they actually do to the eye, because I was freaking myself out. Prescribed a couple of relaxant tablets from the GP. I got those about 3 weeks before and I kept them, and I took 2 of them on the day, so the morning of the procedure. Nervous or you're scared about something, you still feel those feelings even though your body is probably less reactive. The next question, the procedure itself. I'll quickly talk you through this bit because this is a very vague overview about what they do. If you don't want to know too much information about this, then maybe this is good. This is a very quick, like, summary overview. You go in, you lie down on the table, and all of that part is fine. Then they give you numbing eye drops, which I have to say seem to work right away. They don't leave you to wait a while for them to work or anything. They work immediately. The next step is they fitted like a suction over each of my eyes. So they did my right eye first, and then they did my left, but it was like a plastic. It was comfortable enough, it wasn't uncomfortable, but it was tight, and it went over the whole orbital bone. I want to say it went all the way around. I could feel it from this bone here, and each side. They push the button thing and it sucks, and it was lasted about 30 seconds. I think the first 25 seconds was okay, and then the last few seconds, that's like a needle going into your skin pain, more in a, it's being pulled and pulled and pulled, and it kind of gets to a point where, okay, yeah, this is hurting, you know. Creating a flap in your cornea. They did that for both eyes, and towards the end your vision goes black, like it goes off. It goes cloudy white or cloudy grey, and your vision is essentially just cloudy, you don't have any vision anymore. They did the laser corrective part. I was just lying on the chair for like maybe 5 to 10 seconds of just cloudy vision with my eyes open. So if I hadn't have had the tablets, I maybe would have worried at that point, because that's a very strange sensation, is like your eyes open but you have no vision. But then they quickly moved me on to the laser part, and then at that point your eye does get clamped. It's really comfortable. I didn't really feel it, and to be quite frank, I wanted them to just do that last part because I was like, okay, I need to get my vision back. That part again was about 30 seconds for each eye, and you have instructions at that part to look at, you know, there's like red lights and then there's green lights, and then they talk you through like, okay, focus on this, and you need to be really still for this part. So they'd kind of done both of my eyes. I just kind of felt relief because I sat up, and although it was blurry, I could obviously work out colours again, I could work out objects, and I thought it's worked. The last question that I just wanted to cover before I finish this video is, how are the results and is it worth it? So I categorically tell you, if you're in a position to get this procedure done, please do. You won't be disappointed. Honestly, it is so worth it. Like, I'm sat here over a week later, I've done the rest, I've kind of done all of that, and hopefully still my eyes will continue to heal and recover over the next 2 to 3 to 6 months. Contact lenses for me have always been uncomfortable. I have the vision now of wearing contact lenses but without like the scratchiness. First consultation to check that I was eligible, it was 8 weeks after this when I got my actual procedure, so it was only 8 weeks in total from when I decided I was getting it done, booked in, and actually had it done, which I think is quite a quick turnaround, you know. So if you're serious about it and you just want to get it done, hopefully you can get it done as quick as that. Like, everywhere is slightly different. It was Optimax in Glasgow, and they have loads of these clinics throughout the UK. I'll leave the link below to their website and you can have a look. Pricing as well was, for 2 eyes, for my vision, was 2,590 total for both, which I think is very good value for what you're getting, because I was spending, well, I had glasses for one, but I was also spending about £100 each year on daily disposable lenses as well, so that was all adding up. In terms of the recovery, it was really fine, it was really straightforward. I think the first 24 hours to 48 hours is like the most important part, basically. So you have to use the eye drops, the antibacterial ones and anti-inflammatory, and you also need to sleep with eye shields. I'm just going to grab them and show you. It's given antibiotic and anti-inflammatory drops. You put a drop of them each 4 times a day, and that obviously reduces the risk of infection or inflammation. And then you're also given these shields at night, and you have to wear them for the first 2 days, and that's just to kind of stop any like pressure on your eyes when you're sleeping. Or even, you know, you might forget that you've got it done, you might rub your eyes, and that's a complete no-go. You can't, even now, you can't touch your eyes or anything. Even like eye makeup, I'm not wearing eye makeup now. I'm not allowed to wear it for the first few weeks. I'm gonna wrap up this vlog now. If there's any questions, feel free to drop a note in the comment section below. And thanks so much for taking the time to watch this, and I will see you in my next vlog.